So this is going to be a spinal decompression in a hip hinge position. The goal is to, if you think about my hands being our spine, is to separate the segments of the spine to get nice and long so our back no longer takes the hit. So in our hip hinge position, you can kind of play around with how your feet are set up. Some people are gonna like a wider stance, maybe their toes point out a little bit. That's perfectly fine. So I'm in my hip hinge position, soft bend in the knees, the knee bend I choose is what I keep. From here, I'm going to send my hips back as my chest comes forward, like I'm looking over the edge of a cliff. When I'm in this position already, I feel a good amount of tension through my glutes and my hamstrings. I don't feel anything through my back. Now, my chin's gonna be tucked to my throat, and I'm gonna think about keeping my pelvis long, going this direction, but my head's reaching in this direction. From here, I'm gonna take my hands, I'm gonna push primarily through my fingertips on my first finger and my thumb, or my index finger and my thumb. So I'm gonna push in, I'm gonna reach my hands out in front of me. As I bring my hands forward, my head's gonna come, and I'm reaching my butt back, and I'm heavy on my heels. Now in this position, shouldn't feel any back pain, should feel a lot of glute and hamstring going on. I'm gonna take a deep breath in. Deep breath in. And I'm just thinking about being long the entire time, reaching the crown of my head forward, reaching my pelvis back to get my spine to decompress. Deep breath in, I feel a lot of belly and chest expansion. My knees stay stacked over my hips. My chin is tucked to my throat. So overall, this is a pretty good move for people that have discomfort in their low back, especially when they're trying to bend backwards or have trouble with the hip hinge. That's how it's done.